Yes, Dr. Brook, one thing that you hear over again in the media from the proponents of Obamacare is that the opposition has no alternative health care plan. You hear it from politicians, you hear it from the media, that the alternative is if you get sick, die quickly.
Yeah.
What kind of concrete steps or changes in the insurance laws, in the tax laws, would you recommend in order to undo some of the damage that government has done?
So first let me say they were criticizing primarily Republicans, and I think they're right. The Republicans had no alternative, and what they had was pathetic. Now, there was a small group of Republicans led by Paul Ryan that did have a good proposal, and it was simple. Do away with the mandates, or if you can do away with the mandates are just a violation of interstate commerce. There's absolutely no reason a state should be able to regulate these insurance companies. So either eliminate all mandates across all states or allow competition across state lines. That is, allow people to buy insurance across state lines. The idea that I can go to another state and buy a car or a computer, but I can't buy health insurance in another state. Why? Because my lawmakers in California are the only lawmakers in the nation who know what's good for me. The people in Nevada are against me, and I can't buy health insurance in Nevada. So just allow competition across state lines would be huge. Get rid of the mandates in whatever form you can. Taxes. I mean, there are probably 1,000 other regulations that regulate health insurance companies that could be eliminated. You know, there's so many elements within health, and of course in some states, health insurance premiums are actually dictated by the state, so you have to get approval by the state. Get rid of all those mechanisms. Taxes, it's easy. Make all health care expenses tax deductible, or eliminate the tax deductibility of health care expenses at the employer level. But equate tax treatment across the board. So you equate tax treatment. There's no benefit of getting health care through your employer. You buy your own health insurance plan, customized for you because there's a competitive market out there. You don't lose it when you lose your job because the health insurance is your health insurance, not your employer's health insurance. Solves many of these problems. You know, where do you start? You got to privatize. You got to privatize Medicare and Medicaid. In other words, eliminate them, but phase them out over time. You got to have a program to do that now, because again, you're taking on huge amounts of debt with every year that you wait. So you got to start thinking about how you do that now, putting in place a plan in place right now. You got to get rid of the many interventions that the government has in prevention, in in determining what drugs we should and shouldn't use. You got to privatize the FDA. You know, there's a big program of privatization that would be involved in this. But just doing those few things, cross state lines, reducing, equating the tax treatments, and maybe you could do something about tort reform. Although I think that you need real tort reform, not the kind of tort reform Republicans talk about. You need to reclassify liability to what it was 30 years ago, where you really committed negligence. If you don't commit negligence, you can't be legally liable for something. Mistakes happen, and that's sad and unfortunate. But you can't be liable in the way we use it today for mistakes that you make. Particularly if a patient signs that away, but today those contracts are not enforceable. So you need real tort reform that returns us to where we were, in the 40s and 50s in terms of what liability law was in the United States before we became a country that sues everybody for everything because the courts will accept anything as suable. And there's a fabulous book written a long time ago. It was written in the 80s by Peter Huber from the Manhattan Institute called Liability. It's the best book on this topic, and his analysis of the problem is brilliant. And it relates to all liability, but it also relates to medical liability.